Some mesothelioma patients are living years longer with Hithoc, but sadly, not everyone sees those kinds of results. In this video, I'll share the 4 biggest mistakes that patients make that can directly affect your recovery and your outcomes with Hithoc, plus a bonus section on side effects and risks that you need to be aware of. Hi, I'm Deborah from Surviving Mesothelioma. For almost 20 years, we have helped over 18,000 mesothelioma patients understand their options and find hope when they were told there was none. One of the biggest mistakes that patients make is choosing a hospital that doesn't have much experience treating mesothelioma. A 2018 study in the medical journal Lung Cancer found that patients who got lung surgery at medical centers that saw lots of mesothelioma cases were more likely to leave the hospital sooner, were less likely to be back in the hospital 30 days after their surgery, and even lived longer when compared to patients treated at centers with less experience. So, seeing a more experienced specialist may be worth it for some patients, even if it involves traveling. Another mistake is not preparing your body for the operation. Lung surgery can be hard on your body, so your doctor may recommend lifestyle changes to reduce the risks of complications. A 2025 study in the medical journal Interdisciplinary Cardiovascular and Thoracic Surgery found that patients who followed a supervised fitness program before lung surgery did better on the 6-minute walking test. And that's a test that measures how far someone can walk in 6 minutes, and scoring higher on it is associated with better recovery after surgery. If you're a smoker, kicking the habit may also help improve your outcomes. According to a 2025 review published in the journal Clinical Anesthesia, patients who stopped smoking even only a few weeks before surgery significantly reduced their risk of complications. So, following your doctor's lifestyle recommendations may actually make a big difference to your outcomes. Another mistake is not taking your recovery seriously. In a 2024 study in the medical journal Physical Therapy Research, patients who walked at least 10 meters for the first day after getting the lung surgery had shorter hospital stays. They could get their chest tubes removed sooner, and they were able to be more physically active than patients who waited longer before getting out of bed. More recently, a 2022 study in the Journal of Thoracic Disease showed that patients who didn't stick to recovery guidelines had higher complication rates. That means closely following your care team's instructions, watching for early symptoms, and pacing your return to daily life aren't just suggestions. They are part of what improves your long-term results. So, even after a successful surgery, it is important for patients to keep following their medical team's advice. Mistake 4, believing Hithoc is right for everybody. That impressive 38-month median survival came from patients with epithelioid mesothelioma, early stage disease, and good overall health. If you have sarcomatoid cells, advanced cancer, or other health issues, your results may look very different. Some patients push for Hithoc even when they're not ideal candidates, and that can lead to more harm than benefit. Now, let's talk about risks and side effects. Even when patients do everything right, it's important to understand the risks. The good news is that a 2025 systemic review of the World Journal of Surgical Oncology found no treatment-related deaths from Hithoc. But it doesn't mean it's risk-free. The most common issues are atrial fibrillation, irregular heartbeat, and kidney problems. A 2021 study that followed patients for 20 years found that about 18% experienced complications, 5% had prolonged air leaks, 12% developed pneumonia, and fewer than 2% had heart issues. These rates were actually lower than the more aggressive EPP surgery, but they are still important risks to understand. So what is the bottom line? Hithoc offers real hope for the right patients with survival benefits that can be significant compared to other treatments. But success depends on avoiding the mistakes that really impact outcomes. Choosing an experienced medical center matters most. Research shows that results vary widely depending on volume and expertise. Preparing your body ahead of surgery also plays a role. As a 2018 Annals of Surgery review shows that prehabilitation improves recovery and lowers complications, while a 2019 study in the same journal found quitting smoking just weeks before surgery reduces lung risks. Recovery does not end at discharge either. Following structured recovery plans like those described in the 2019 European Journal of Cardiothoracic Surgery Guidelines helps lower complication rates. And a 2022 Journal of Thoracic Disease study confirmed that skipping those steps increases risk. And finally, not every patient is the right fit. The impressive 38-month median survival came from early-stage epithelioid patients in good health, and for others, results may differ, and pushing for Hithoc when you are not an ideal candidate can backfire. The most common complications, atrial fibrillation, pneumonia, and kidney issues, are usually manageable, but they're real. A 2025 World Journal of Surgical Oncology found no treatment-related deaths from Hithoc, but risks remain, and they must be weighed carefully. If you're considering Hithoc, the strongest path forward is clear. Work with an experienced center, prepare your body before surgery, commit to recovery protocols, and get a thorough evaluation to see if you're truly a good candidate. At Surviving Mesothelioma, we have been helping families navigate this disease for nearly 20 years. We offer free resources that explain all treatment options, not just Hithoc. Whether you're a candidate for this treatment or exploring alternatives, we're here to help. One inspiring example is Paul Kraus, the longest living mesothelioma survivor on record. Paul lived more than 27 years after his diagnosis by combining alternative approaches with medical care. If you'd like to learn exactly what he did, you can request a free copy of his book, Surviving Mesothelioma. Just click the link in the description and we'll send it straight to your door. Stay informed, keep fighting, and never give up hope. I'll see you in the next video.